Hi again, I'm Dr. Mark Trolice, the Director of Fertility Care here in Orlando, Florida. And I wanted to discuss something that is a very serious problem in reproductive aged women, and not everybody is aware, and it's called the Female Athlete Triad. Now this is a condition that is diagnosed based on having three issues. One of them is a decreased energy expenditure. In other words, you're using too much of your energy and not taking enough calories in. So from excessive exercise, you're not replacing the calories that you burn, and you run the risk of weight loss as well as decreased energy. You don't necessarily have to have an eating disorder like anorexia or bulimia with this problem, but it can be associated. The second issue is having irregular menstrual cycles or even a lack of periods completely, and that's called amenorrhea. The third is bone density loss, or something called osteopenia, which is a lower bone density, or osteoporosis, which is significant bone loss, increasing the risk of fracture. Now, why this is important is because it can actually be life-threatening. Patients whose periods stop because of this problem can have a 5% risk of death, and up to 30% of patients will still have problems with their menstrual cycle even if their weight restores and their energy balance improves. So when somebody like me sees this patient, they're trying to conceive, but they're not ovulating. And the best thing to do for these patients is not just give them ovulation-inducing medication, but to help restore energy and hormone balance in a natural method. And this can involve psychological counseling as well as nutritionists getting involved to help them with their diet. If nothing else is wrong with the patient and they're trying to conceive and the male has a normal sperm analysis, then the patient has a good chance of being able to conceive. But it's important to recognize this problem as a much more serious condition than just not having ovulation function. I hope this was an educational session for you all, and I look forward to another topic soon. Take care.